Good afternoon and welcome to the first of KACF's In the Frontlines of COVID-19 Virtual Giving Summit series. I'm Kyung Yoon, the president and co-founder of the Korean American Community Foundation. And on behalf of our board and staff, we are so pleased that you've joined us. Now, some of you attended our giving summits in the past, the physical ones, and you know that it was designed to bring together Korean and Asian Americans to explore and celebrate giving in its many forms, including philanthropy, volunteerism, ward service, and other ways that we can give back. But in this time of the COVID-19 pandemic, how do we give for greatest impact? And what are the most pressing issues? We saw the need to continue our Giving Summit, to bring our community together virtually, to hear from our grantee partners who are on the front lines of the pandemic. Now, in this time of uncertainty for everyone, there's a lot that we don't know. But something we do know is that those who were vulnerable before COVID-19, especially older adults, low-wage workers, people who can't speak English, and those who don't have insurance, they are the hardest hit by the pandemic. And we've been so moved by how many of you have reached out to KACF asking, how can I help? What are the biggest needs? And that's why we retooled our Giving Summit in this virtual series. And I'm thrilled to say that we have more than 50 participants on this Zoom event. And to me, that speaks to the interest and the heart of our community. So joining me today are two amazing nonprofit leaders, Linda Lee, the president and CEO of Korean Community Services of Metropolitan New York, and Joanne Yu, the executive director of the Asian American Federation. They are both on the front lines advocating for our community and for a social service organization like KCS, literally providing lifelines like meal delivery and other vital services. So Linda, let me start with you. Could you tell us more about what KCS does?
Okay, can everyone hear me? Hi, everyone. Thank you so much, Kyung and KACF, for putting this together. It's nice to see so many familiar faces as well and community leaders, and it's nice to know that we're all connected somehow, which is great. So for those that are not familiar with KCS, we are a social service nonprofit organization that has multiple services. We have 7 locations currently, 1 in New Jersey and the other 6 are in New York City. Currently our staff are at about 110 and we offer multiple services, everything from ESL classes to we have an adult daycare program. We have 2 senior centers, one in Corona, which is kind of ironic that it's in Corona, Queens, but our senior center is in Corona and the other one is in Flushing. We also have a lot of public health related services, workforce services. And at the Corona Senior Center, that's where we have our Meals on Wheels program, which is the only one that serves the Korean community in New York City. And we also have in Flushing our mental health clinic, which, we're the only Korean nonprofit right now that has our state licensed mental health clinic that operates in Flushing.
Thank you. And Linda, you mentioned the senior program. With all the social distancing, the program must have had to change completely. So can you tell us a little bit about that?
Sure. I mean, if you can imagine, just take our Flushing Senior Center, for example. There were about 350 seniors coming out daily. It was very active, very vibrant. We have about 25 to 30 classes that we provide also for the seniors weekly, as well as breakfast and lunch. So we've totally stopped all of our, congregate activities, classes, and we've shifted more to assurance calls, right? So all of our staff are making sure that they're calling the seniors daily, that they are doing okay, seeing what their needs are and how we can provide assistance virtually. We've also been shifting much more of our services to our homebound meals and also talking to the city to see, okay, since obviously seniors cannot come to the center for meals, for those especially that are most at need, would we be able to provide delivery services for those seniors as well? And these are all things that we're trying to, come up with on the fly, because, even the city is trying to figure things out. This is a very unique situation for everyone. And so we're constantly in touch with other, community partners, the government, to see how we can continue to address these needs and make sure that the most vulnerable are getting served. And it's causing a lot of shifts and decisions from an organizational standpoint that we have to make. We're redeploying staff from one department to another. There's more of a need for drivers now from our staff. The increase in costs to microwavable containers for home delivered meals, that's increasing as well. Making sure that the spaces are clean. How do we, and I think what we're struggling with is how do we continue to serve the most vulnerable, but also at the same time make sure that our staff are protected, that they have the cleaning supplies, they have the masks and the gloves and everything they need to deliver this food. What protocols can we put in place to make sure that they're protected? So, for example, instead of having staff come out every day, we have them come out Monday, Wednesday, Friday, and we're actually doubling up meals on each of those days. So we're delivering 2 days worth of meals each day. And we're, trying to make sure that we're rotating staff so that in case, God forbid, something happens and one of our staff do get COVID-19, that it's not a complete wipeout of all of our staff that need to be quarantined. So we're trying to make a lot of those shifts. But of course, we're most concerned about the seniors. They're experiencing a lot of social isolation. And just to give a very brief anecdotal story is, our Flushing Senior Center had to shut down for 2 weeks completely because we did have a client that was positive for coronavirus. And so to ensure the safety of staff and clients, we totally shut it down for 2 weeks. And this past Monday, we opened up again, specifically just for the meal delivery portion. So our staff were there to prep for the food to go out for delivery. But somehow through the grapevine, a few of our seniors heard that we were opening. And so when our director got to the center, there were a bunch of seniors waiting outside because they thought we were opening our programs again. And, we were like, no, you have to go home, make sure that you stay safe. But I think it just speaks to how people are really wanting to have that, interaction and to be around others during this time as well.
Yeah, and it must be particularly hard for seniors who may not be the most tech savvy and actually are not able to connect through technology. Are you seeing a lot of sort of, just mental health issues around the isolation? I know that so much of the work that you were doing prior was around not just providing a place for a hot meal, but really around the fellowship and the socialization that the senior center provided.
Yep. So we're trying to be very creative about how we're reaching out to the seniors. And one thing that's been very popular is Kakao, like Kakao chat rooms. Because even if the seniors are not the most tech savvy, for some reason, a lot of them do know how to use Kakao. And for those that don't know what that is, it's like, the popular Korean chat version of like WeChat or those other chat spaces. And that's been actually a great way for us to have the instructors connect with their classes, to just check in with people, make sure they're okay. But it is a challenge. I mean, that's why the assurance calls are so important, because our staff are literally the seniors on their phones every day, just checking in on them. And we're trying to help out in whatever way we can, whether it's over the phone, virtually, if they want to connect on FaceTime, we're trying to see if they, can do that as well.
Thank you. And I know that in addition to the elderly population, KCS is also taking on a lot of work to help small business owners, people who have lost their jobs. Can you tell us about what you're doing there?
Sure. So a lot of folks have been calling us because they do need assistance with unemployment insurance applications, and also the small business loans. I'm sure a lot of us in the community have been receiving a ton of information about the PPP as well as EIDL loans that are out there for small businesses. And, you know, we've gotten so many calls that we were like, okay, how do we respond to this? And how do we meet this need? And so one thing that's become very clear is that it just reiterates the barrier in language access issues. Because the applications are only in English. And for folks that are fluent English speakers, even then it could still be a bit confusing, or the way you interpret the application could be confusing. So a lot of folks have been reaching out to us. And so in response to that, our team internally quickly got together and we decided, okay, which one of our staff members who are currently not as busy because their program activities have slowed down, who can we sort of shift and redeploy to get trained and then also provide telephone or virtual assistance to these clients. And so we quickly had one of our board members, who is actually an SBA lender, say, hey, do you mind training our staff, and then maybe even potentially doing some webinars for the community? Because I think a lot of them know that these grants and loans are out there, but they're not sure how to apply. If they're cash businesses, you know, how do you pull the necessary documentation from their tax returns? So it's not just the application itself, but I think there's a lot of assistance that's needed in just preparing the documents that they need to apply as well. So we're really trying to see if we can sort of meet that need and the demand, because that's a lot of the calls that we're getting lately. And of course, there's other community partners out there like Minkwan, CASE, KFSC, YWCA in the Korean community. Like, all of us are really trying to be as responsive as possible. So we actually do have a group chat with a bunch of the Korean leaders, and we've been sharing translations. Minkwan came out with a translation for some of the applications, which is great. And so we're trying to figure out how we can piggyback off each other and meet this need together as well in the community.
Great, thank you. We'll be coming back to some more of the work around the small businesses later, because I know it's such a pressing issue. Right now, I want to turn our attention to Joanne Yu, the Executive Director of the Asian American Federation. So Joanne, could you tell us a little bit about what the Federation does?
Hi, everyone. Thank you so much, Kyung. Thank you, KACF family. I really am thrilled to be here on such sad occasion, actually. I mean, this is just, you know, so tragic what we're going through, but, you know, it's week 4 of the work from home. And so I appreciate this opportunity to dry my hair today to join the Zoom call. The Asian American Federation is a leadership convener organization for about 70 nonprofits that serve our city's Pan-Asian community. We are known for our research that frames our advocacy work on immigration and integration, mental health, seniors, small business, technical assistance, and leadership development. We've, you know, had the sad distinction of, you know, convening through tragedies like September 11th attacks, through Hurricane Sandy, when our community needed to be rallied so that way we can support those most vulnerable. And we are again. The one thing I want to remind everybody, it's census time, so please, you know, it's the easiest thing you can do at home. We are a census designated information center in the East Coast, so, you know, our hands were pretty full before COVID-19 hit. We were, you know, making plans to work throughout New York State and New Jersey. So now our census work has shifted virtually.
Okay, thank you. And I know Linda talked about KCS's work with small businesses. I know the Federation has also been doing work with Asian business owners for years, and you've been an advocate since the outbreak, even more so. Now, how is the Federation helping small business owners?
We are working on a website to get information up. I think the challenge with the website, something so simple like a website, is that information is changing so quickly. For us, it really is about serving the Pan-Asian community. So beyond Korean, we need to do it in Chinese, we need to do it in Nepalese, as many language as possible. You know, I want to underscore the fact that the Asian American community has been dealing with the economic impact since January. Since you know, this wasn't just you know, March and we have a lockdown and we're all, you know, the entire country is panicking about what is happening, but we've been sounding the alarm since January. You know, small businesses or restaurants were closing. By February, you know, small Asian American small businesses were telling us that they were suffering from 50 to 90% loss. So we're organizing them. We are sending letters to our elected officials to fight for some tax breaks. Linda and I worked till pretty late last night to work on some trainings to help small businesses understand the loan programs that are available and to be able to help them to prepare to be able to apply for that. I think that, you know, the information out there is, you know, there's all this free money and, you know, we can all apply, but it requires a lot of paperwork and you need to be able to get all of that together. The money is going, you know, the registration is going very quickly. And so I know that time is of the essence, but there needs to be a lot of prep time. And for those immigrant small businesses, particularly who have a language barrier, it's really hard for them to understand what these what the checklist is. So KCS and the Federation, we're going to be planning a webinar, series of webinars on like what documents are needed, you know, what you need to think about, what are some of the pitfalls. You know, it's there are caveats and there are people who are not going to qualify, and we need to be able to steer our community in the right way.
Thank you. And just hearing from both you and Linda, I see the critical importance of language access for immigrant communities that have limited English proficiency. And I know how stressful that is. Like even when, I mean, I speak English and not being able to fill out forms sometimes that are just, you know, so difficult to understand. And and when I think about the stress that this creates, I also want to lift up, you know, like the work that you guys have been doing around raising the awareness of mental health issues in the Asian American communities, and particularly around social isolation. What have you been seeing or hearing about how people are affected?
Well, I think all the things that, you know, around mental health at our community, all of the challenges that we've had, I think it's just been exacerbated by a gazillion fold since we are all at home. You know, we are in isolation. It's hard not to, you know, even as an introvert, it's really hard not to see people every day. I think the biggest barrier to getting mental health services for our community is the stigma of mental health itself. Our community sees mental health as a secret shame instead of a medical problem that can be overcome with counseling, with medication and awareness. So, and for us as a leadership organization, our greatest concern right now is the stress of our nonprofit staff as they worry about their clients, their own families, the kids who are now home, and they have to, as parents, they have to offer assistance with schoolwork, and about keeping our doors open now and in the future when, you know, when we all get to leave our homes and apartments, it's going to be the nonprofits who are going to be, again, the frontline workers to ensuring that we build the infrastructure once again to be able to help our community, to be able to have jobs, to have food on the table, to be able to get healthcare services. So we know that you know, this is a huge lift, but we are putting together mental health work throughout the city with KCS, with Hamilton Madison House, with Arab American Association of New York, the 3 Asian Americans, Pan-Asian organizations that actually have mental health services, clinical services. So we are, you know, that work, we were pretty deep into that work before COVID hit, and we are continuing to do that work. For us, we recently conducted a counseling session for executive directors on how to work through some of the stress. We are planning one for the frontline workers, and we have a survey out to ask the kind of support our community needs. And, you know, this is an ongoing challenge, and I'm sure the longer we are all home, the more we're going to be feeling it. So we need to put our collective efforts together to ensure that, you know, those who are vulnerable and feeling the stress get the help that they need.
Thank you. And Linda, KCS has a state certified mental health counseling center now. Have you seen an increase in the need for services, and how is KCS providing assistance?
So the good thing though is that we've been able to maintain our clients because the State Office of Mental Health normally has very strict regulations and guidelines when it comes to virtual services. But because of the uniqueness of this whole situation and in response to COVID-19, they've actually allowed clinics to offer services virtually. And, you know, they even loosened up their regulations further because there are certain HIPAA, you know, compliant online tools that you're supposed to use when you're doing telehealth medicine and counseling. But even that went out the window, and they're saying, okay, use FaceTime, Google Chat, you know, Zoom, phone calls, Kakao even, and WeChat they're allowing as well. So they're actually allowing us to use all those different means to connect with our clients, which is great. We have seen more referrals. We have not, like even within our services and programs, for example, the senior centers, we have some clients that the directors from other programs have been referring to the mental health clinic because of people really not, you know, they're really depressed and anxious because of the isolation, because they don't know what's going to happen. A lot of them are stressed out because of their businesses, you know, shutting down and they don't know what to do. So there is a lot of that there. We haven't seen a huge increase in terms of the number of requests for services. And I was talking to the clinic director about that. And to Joanne's point, I still do think a lot of it is because of the stigma that's attached to mental health services in particular. I know that I was talking to Jihe from KFSC, and they've seen a huge increase in their hotline calls. And I think, you know, hopefully from there, what we will see is if there is further assistance or need in terms of more long-term care for mental health that needs to happen, then hopefully we can help those clients and catch that area. And the other concern that I have also is for a lot of the staff who are on the front lines and also stressed. And that's something that we spoke about internally with our senior executive team is, you know, how do we utilize some of the expertise in our organizations that have clinical services to also offer assistance for staff? Because I know that being on the front lines, being out there in the community, knowing seniors that are dying and that are hospitalized and sick, and seeing that day to day, it can get very, very stressful. And so that's also something else that we're trying to be aware of. And you know, a lot of our staff have families that own small businesses, and you know, their businesses are no longer in existence. And so how do we help staff and support them as well? So those are all things that we're facing right now.
Thank you. And I just want to provide a little context. I know you had said you'd been speaking with Jihe Fisher from the KAFSC, which is a Korean American Family Service Center, also one of our grantee partners. They provide services, you know, for families that are affected by domestic violence, and we are seeing a really alarming uptick in, you know, in calls to their hotline. Mm-hmm. But I want to just zoom out a little bit and focus our attention also on the rise of racism and bias against Asian Americans because of coronavirus. Now, Joanne, I know that the Federation has been very vocal about how leaders in our government need to address this and to do so strongly. Now, can you tell us a bit about your work?
Sure. Our work really started in January. You know, when the news hit, when you see the economic decline of Asian American enclaves, you know why that is, and that is due to racism. And we recently created a website for Asian Americans to report hate and bias crimes. I know that there's a national site, but that's based in San Francisco, and we made the decision to create one for the New York, New Jersey, Connecticut area because we have existing relationships with law enforcement in the tri-state area, and we thought it'd be easier to refer victims to proper law enforcement entities. And really for us, this was a need to collect data to report what is actually taking place in the community. I think, we've all seen the articles about, how we are victims of the model minority myth, and now we're, victimized, by horrific racism. So we do need to, and the website is an opportunity for us to raise awareness of the difficulties of hate crimes that impact our communities, and to raise our voices on the terrible things that are happening to us now. And that the statistics is not just anecdotal evidence. It's actually, hard evidence from people who've been victims who've been impacted, that can be used by our elected leaders to demand legislative reform. And for the fact that we do need to receive funding to be able to work through these, to be able to educate our own community, but work in solidarity with communities that have been impacted. The first communities that really reached out to the Federation to say, we want to help you, has been the Jewish community. All the anti-Semitic attacks they've been experiencing. Also the Black community and the Arab community, the Muslim community. So we are working together to be able to host, schedule some bystander training, social media, anti-bullying trainings. And our biggest project right now is to work with federal, state, and local law enforcement to create direct lines of communication to teach our community what hate crimes is, because I think everybody is really confused about exactly what constitutes a hate crime from a federal, state, city level. So this afternoon, we're going to be hosting a New York State Division of Human Rights commissioner and the lieutenant governor to discuss discrimination. And then the session with the NYPD will be on Friday, and we've twisted the arms of FBI to work to host a seminar in a few weeks. Right now, this is really for the advocates, because I think we need to understand what to look out for, how to sort data, how to convey information. But certainly something that we've advocated for is, it can't just be the 17 EDs who know how to do this stuff, but it really needs to be the community to raise awareness. So we're pushing to be able to host 100 people Zoom calls. And I said, as many as we need to do them, we need to do them. So once we have finalized those dates, we'll certainly share with you, because we would love for KACF supporters to be able to join us.
Great, so thank you. And before we go to our Q&A, I just want to, just ask you, Joanna and Linda, like so many of our audience has been asking, like, what can individuals do to help in these times? So do you have any suggestions? I'll start with Joanne, and then we'll go to Linda.
Sure. So I'm going to say, my census team would hate me if I didn't say the first thing you should do is to fill out your census form. It's really quick. And that, the Asian American community is slated to be a hugely undercounted community. So while we're all at home, we need to be able to fill that out. I think that is the easiest civic activity that we can do together as Americans. But we also need to pay attention to legislation, and the call to action that I have is, groups like KCS, like the Federation, we will be sending out notices about what is happening with the various stimulus packages that excludes much of our community. Some of the packages that have come down, the Asian American community, many of members of our community cannot access it. So we're right now pushing very aggressively to extend benefits and programs to be able to capture all the people that have not been recognized in the first round. So, I'm sure everybody realizes, but if you call your senator or your legislator, they do pay attention to those things. They do mark off who called, who was a voter in their district, and they when the vote comes down, they do pay attention. So I think I just want to empower all of the participants here that our voice is much more powerful than we think, and we need to stand up for each other during these really dire times.
Thank you, Joanne. Linda, do you have anything to add?
Oh, can I be so bold as to say for a lot of our groups, it's really funding. and dollars for general operations. And I know that's not sexy when we're talking about, you know, funding and programming and needs, but I think in this situation, the most important thing for a lot of our groups is the need for unrestricted, flexible dollars. Because I know that for groups like KCS, for example, if we get funding from government, it's very restricted. Like I can't shift line items between my budgets, right? So if it turns out that in this coronavirus situation, we're providing less meals because there's not as many seniors congregating, but we're spending more resources on personnel, on supplies and equipment, then, you know, rarely do they allow us to shift those dollars around in between line items. And I think that's one of the challenges. I know it's a little bit more nuanced, but, you know, that's why I think foundations, particularly at this point in time, you know, I have to say, you know, shout out to KACF because, you know, one of the first things that you guys said to your grantee partners was feel free to use these dollars and shift around the money however you need to support whatever rising needs that you guys have. And I think that's really crucial at this point in time because I hate to say it, most of the times I like to think that I'm an optimist in most situations where I think of the glass as half full. But, you know, when you think about the big picture and you think about the fact that the state is already in a $6 billion deficit, and on top of that, you add in all these new challenges and expenses around coronavirus and relief programs, are folks really going to be looking to fund non-essential programs? As important as we know they are, if the folks have to pick and choose, okay, where is the funding going to go? You know, after 9/11, after Hurricane Sandy, a lot of the first things to get slashed in the budget are social service organizations, people on the front lines. You know, the mayor just announced today that he wants to slash like millions of dollars from the DOE budgets and schools. And how is that going to have impact? And it will have an impact. And, you know, I had a very sobering conversation with my staff and directors yesterday during our check-in meeting, because I said to them, listen, I think we have to assume that nothing at this point is guaranteed. And our priority right now is to just survive as an organization so that we can continue to provide services tomorrow and after this whole thing is over, right? And how are we going to help rebuild the community? And I think at this point, we may have to really have, you know, hard decisions to make where we have to cut our own programs and perhaps slim down and trim. But, you know, at the core of it, I think we have to figure out how are we just going to survive and get through this, and also rebuild and figure out how we're going to meet the needs once this is done, and maintain the services that we are right now for the most vulnerable community members. And I think that's been a huge challenge for us. And it's, you know, we're part of different coalitions and membership organizations. And, you know, the sad reality that a lot of us are facing is that a lot of these nonprofits who are oftentimes on the front lines providing these essential services, their cash flows are already tough to begin with. And, you know, this is definitely going to have a trickle down impact, I think, on our community. So sorry, that was sort of like this is what our needs are, but a bit of concern and, you know, frustration too at the same time. And, you know, I think there's been a lot of positive conversations though that have been coming out of this in terms of the community wanting to really rally together. And so I think, you know, that's really what a lot of these groups need, is to help survive. Yeah.
No, thank you. No, I think you really covered so many things that our nonprofits are facing right now. And just, I think, the uncertainty that so many of us are feeling. And yet, you know, at the same time, I think particularly for our community, it's been a challenge because we do hear about like a lot of foundations, you know, coming together, big, you know, grant pools from the New York Community Trust, and those are wonderful. But in many ways, sometimes they exclude those who are, you know, again, like focusing on the most marginalized in our communities. And so I think what KACF has been trying to do is to also marshal, you know, not only our resources, but our community's resources, that we can tackle some of the issues that are often invisibilized and also voices that are not heard. And we just so appreciate, us, having these kinds of opportunities to amplify your voices so that people can hear what is happening on the front lines, in immigrant communities like ours, but also what is the collective kind of solutions that we can come up with. So I am, getting some of the questions from our audience, and one of them is, what is your assessment of the stimulus package for nonprofits? Joanne, do you want to start on that?
Sure. I think the stimulus package for nonprofits is lumped in with everything. It's just this giant pot of money, and you need to scramble to get in line. I was talking to Linda last night because I was working on my application last night. It really is the funding Hunger Games at this point. We're competing with everybody, from the mom and pop shops to the nonprofits with 500 staff members or less. So we're trying to understand exactly what the how to even apply. It's very complicated, actually, and unless you know somebody who knows how to do it, it's been impossible. You're supposed to go through your bank to be able to do it, and we bank with two of the biggest banks in the country, and they just don't want to even take your call because they don't want to do it. So we know that it's been really difficult. We understand. We can only imagine the challenge of a really small organization that doesn't necessarily have all the documents that we have. My fiscal folks have been working overtime to put the documents together because they ask you for a gazillion things. But we know that there's going to be there's going to be several packages. And I think we need to be able to, we are definitely, I serve on the board of Nonprofit New York. And, one of the things that we're doing right now is to really aggressively push, Senator Schumer and Senator Gillibrand, all of the New York congressional delegation, to be able to appreciate the role of nonprofits. As I understand it, I think in New York, we are 19% of the workforce. But, I keep reminding people when the all clear happens, we're going to be the ones, who are going to have to get our hands dirty to rebuild society. And so, like Linda said, we need to stay alive as long as possible because we're going to need to feed our people to be able to get them jobs. So, yes, and the challenge is, we want to do trainings for the nonprofits about how to apply, but the rules change literally, it feels like it's every 5 minutes. So, there's going to be stuff that we are putting up on our resource website. And as we, as soon as I get information, it goes up there. So anything that we have, we're happy to share. And people should feel, if they get updated information, they should also let us know so we can get the word out to folks.
Great.
And what I've heard on the ground is that for EIDL, that's the one where you apply and then you can get a $10,000 advance. That has been kind of like a crap show in some ways because they're supposed to get organizations are supposed to get the funding within 3 days. Not many people have gotten it. I think the focus for a lot of small business owners and even us as nonprofits to apply is the PPP program, which is the Paycheck Protection Program, which I know a lot of you guys have heard about. I really highly encourage folks who may be eligible to apply. If you haven't done so, just do it, because even if the stimulus money runs out, and they're actually predicting that, because as soon as the applications went live last Friday, there were billions of dollars that already went out, and they're predicting that the funds will run out by this Thursday, by tomorrow, actually. But they're encouraging people to still apply, because at least if the government decides to put more stimulus funding out there, at least you'll have an authorization number, which means that you're in queue, you're in line, your application is in line to receive funding. So I really strongly encourage folks to apply for that.
Great, thank you. And I know that, we've been really focusing a lot on the immediate needs, but we have a question from our audience that we are assuming, and they're assuming, that there will be longer term impact of COVID-19. And so what do you foresee, as these medium and long-term effects to be? And I think you've touched on it a bit, but Linda, would you like to take that on?
Sure. I think it's on a, I think there's a couple tiers that we're thinking of is, I mean, even for the community, yes, there's going to be definitely long-term assistance that we need to help them with. How do you help someone who spent 20, 30 years of their lives building a small business that is essentially no longer in existence? And how do you help them pick up the pieces? And I think that's something that we don't necessarily have the answers to yet. We are trying to see, how the response is from government and what programs will be out there to assist those community members. And then I think even for us as nonprofits, we're trying to figure out, how do we, like I mentioned before, survive most importantly as an organization so that we can still be around to help folks later. I know that there were similar challenges like this with Hurricane Sandy, 9/11. I think what Joanna and I also and other nonprofit groups need to do is advocate on behalf of the community. For example, I heard this wasn't going to happen, which is good, but for folks that are getting temporary relief from mortgage payments and things like that for our community, I heard that after Sandy, what happened was that actually impacted their credit scores negatively. I did hear that that's not going to be the case this time around, but just ensuring that also from a policy level that there are assurances that will include our communities, our immigrant communities, and make sure that in the process of trying to rebuild their lives, that it's done so in a way that's equitable and that can really help them in a meaningful way.
Yeah, thank you. And I know this might be a very difficult question, but I'm getting one that's saying, can you provide some sort of target, like general rounded number as a reference point, to give a perspective of what kind of cushion does KCS and other nonprofits need to continue general, operating and to be able to survive, and not only survive now, but for, the longer term when so much of our community is going to be relying on you?
That's a good question. I think that's one that we're even trying to figure out as we go along, because, the city budget cycle ends June 30th. So what we've heard from a lot of the city agencies and the mayor's office is that they will try to honor our contracts, our FY20 contracts, as much as possible until June 30th. However, I think the big question a lot of us are asking ourselves is, what is the FY21 budget cycle going to look like? And that's really the big question right now that we're trying to figure out with government agencies, because again, when we see the mayor and governor proposing budget cuts already, I think that makes us a bit nervous. I mean, we have our budget has been around 6 million for the past couple of years. But a lot of these groups, I know that in the Chinese community, we're working closely with CPC, for example, and Hamilton Madison, all these other groups that are larger. It's going to have a huge impact on our bottom line. And so I think it depends on what programs they choose to cut, whether it's home care services or educational programs. And I think that will definitely impact organizations differently. And then you got to throw in there, of course, the fact that a lot of the fundraising events that a lot of nonprofits rely on, including their galas, are not going to happen this year. And so for a lot of organizations that rely on those donations, how are they going to supplement that in addition to government cuts? And so it's a long-winded answer to say that we don't really quite know yet, but I don't know, Joanna, if you want to add something in terms of what you're seeing at City Hall and the governor's office, but.
Sure. I think, everything is being slotted over for relief efforts. And, the answer is we don't even know what the budget's going to look like. A lot of the social services groups get funding through through contracts. The Asian American community is, 15% of the population, but we get 1.4% of the city contract dollars. So we were operating with a huge deficit. Like we didn't even make it on the, to double digits. So we always worked from a place of scarcity without resources. I know that private foundations, contributed to our community even less than that. So we were not well resourced. A lot of the programs that we see people running, a lot of our member agencies run, have been doing it through donations, individual donations. But as people become unemployed, I don't know, those donations are going to dry up. So we're going to have to cut back services. We're going to have to shift back. The rule for nonprofits is, a sound nonprofit, you're supposed to have 6 months of operating in the reserves. And we all laugh about that because we're like, we don't even have 6 weeks. Like, what are they talking about? Because if you have a contract and they're not paying you because for various reasons, somebody loses a paper, it takes forever. Like here we are in April and we are still closing out contracts from last fiscal year. So if it's that slow, money, like the rule with any kind of government contract is you need to spend the money first and they reimburse you, which means that you have to have some money to be able to operate. So the answer is we don't know what the numbers are. It is how, ideally we'd all be able to have enough resources to be able to pay our staff and keep our doors open. But we also know the reality that when this is all over, we're going to be, the nonprofit organizations will also be contributing our employees, our former employees to the unemployment line, because there is no way that we can sustain this the way we have been, especially because we were underfunded.
So I think we are seeing, and as both of you are underlining, and I think Linda said it, very bluntly at the top too, that the biggest challenge for nonprofits right now really is about funding. And we understand the importance of that. And I know that Joanne, you also talked about just being engaged, and in terms of doing the census and speaking out. But just how, is there anything else that you could talk about how people can help at this time from their homes? We're getting a question: would anyone be able to, for example, help smaller nonprofits apply for the stimulus grant? Especially for nonprofits who don't have great English speakers. Is that something that could be a volunteer opportunity, or is there even capacity to be able to coordinate a volunteer effort like that? Linda, do you want to take that on first?
Yeah, actually, that's something that Joanna and I were talking about yesterday is how do we also not just help the community members and the small business owners, but other nonprofits that do need to apply for this. And the way I learn is I have to go through the process and then I learn. Like, I'm not one to like read documents and then study that way. So, I have to say it was very helpful even for our own organization to apply for it. And then once we did that, we were better able to understand, like, okay, this is actually not so easy peasy 1, 2, 3. Like, the application itself may not be that bad, but it's the documents that you need to prepare for the submission of the application. So that's something that Joanne and I, talked about in terms of being able to provide that assistance. Personally, I think another area that people could help out with from their homes is, we got a lot of amazing professionals in our networks, and I think there's a lot of questions that the nonprofit partners are experiencing around HR issues. How do we deal with furloughing employees? What does that mean for us in terms of an unemployment, benefit perspective? How does, because I don't know if you guys realize also, but for nonprofits, in order to be, have the PPP as a forgivable loan, you have to make sure that you're maintaining 75% of the staff that you had before. And so things like that, we want to make sure people know and understand. And also, if there's any CPAs out there or folks that can help, because I know CPAs are charging community members, which I totally understand that as well. But, especially for the ones that are, that don't have the means or the funds, I think that could also be a great way to help, is offer Professional services, perhaps pro bono, and partner with groups like Joanne's who have access to a lot of member agencies that could be able to filter that out. I think that would also be another way to help.
Absolutely.
Joanne, do you have anything to add?
Yes, I think everything that Linda has said, but also, when the quarantine lifts, we're already realize that so many of the small businesses are going to have to file bankruptcy because there's just no way that they're even making it now. I think the small businesses had such a small profit margin to begin with, and for them to dig out of this, it's going to be really tough. So, yes, the importance of professional services to be able to business counselors, people who actually know how to help people maneuver, to be able to help small business to, get through this really tough time. I think it's not just, our plan really is about figuring out how to help our community, not immediately after, but also, 6 months after the work that we're doing with small business, 6 months after, a year after, we need to go back and make things retroactive, fight for a policy that makes sense. So professional services for sure. But, one of the things I also want to lift up KACF and why I appreciate this so much, because Kyung, for us too, we're a small organization, we're 15. And I think, to be honest, like these days, because we are a leadership organization, we are really like, there are days when I hit the wall pretty quickly, but those, that's usually at 2 a.m. when I realize like, I need to go to bed because I can't do this anymore. What I'm really grateful for KACF is because, you guys are writing checks that say, what is your need? All the folks that are here at this conversation, participating, if you can write a check to KACF because you know who all the players are and you know exactly the kind of work that we do, because it's not, our relationship is beyond grantor grantee. We don't see you once a year when we ask for money. We see you guys regularly, and you know exactly the kind of work that we're doing. And when Linda talked about the needs of the nonprofits, there were nonprofit organizations that didn't even have laptops to send home to their staff members to be able to work from home. I mean, that is an impossibility. In everything from, setting up a basic infrastructure for people, to be able to have a laptop, to be able to even have internet, to be able to work from home, to set up a home office, that was a luxury for a lot of people. Now we're dealing with, thinking about like, how are we going to do the cleanup after the all clear? Like, how extensive is the cleanup? How do we get cleaning supplies if we can find cleaning supplies? How do we pay for staff to get to the office because they're afraid to take mass transit? And we saw some of those horrific photos of people jam-packed into subways because they're running them less frequently, and the people who are going to work are the essential workers or people who have no other choice but to go to work because that's the way they're going to feed their families. The stories that I'm hearing, I try to check in with EDs on a one-on-one basis. I will make calls to people just to see how they're doing, and the things that they're telling me, it's just unbearable to hear the kinds of things that we're all seeing. And so I'm really grateful for this call, for your invitation, but also for all the great work that you're doing to make sure that we get through this period, but we're able to be there for our community on the other end.
Thank you so much, Joanne. And I'm afraid our time is up, and I want to thank you, Joanne and Linda Lee. And I think this is to be continued. And I just want you to remind everyone that you can report hate crimes, bias incidents against Asian Americans at the Federation's website. And we'll also be sharing information to contact or donate directly to both KCS and the Asian American Federation. They're two of our many grantee partners that are doing critical work for our community. And actually you can learn more about all the nonprofits that KACF funds on our website. And there are also many great organizations doing work nationally and locally to support our community and raise the voice and visibility and influence of Korean and Asian Americans. And I want to give a special shout out to the Council of Korean Americans, or CKA, to Cagney here in New York, as well as family foundations like the On Family Foundation that has steadfastly been supporting our Asian American community, and of course our affiliate, KACF of San Francisco. And finally, we hope you will consider donating to our COVID-19 Community Action Fund. And I'm really happy to share that we'll be announcing tomorrow that we are awarding $60,000 in this first wave of COVID relief grants to fund food deliveries to low-income families, Korean language assistance in completing unemployment and small business loan applications, domestic violence counseling for these times, and a COVID-19 health hotline and telemedicine in Korean language. And we're getting more requests than we can fund, and we hope you will help support our COVID-19 Community Action Fund, and the link will be shared via chat box. And finally, I just want to say we're planning more Giving Summit events in the coming weeks, including conversations with medical professionals, journalists, and others on the front lines of the pandemic. And we hope you'll come back and join us for those conversations. And remember that even in this time of social distancing, we can stand together. We can give together and build community together. And thank you so much for joining us.